The World Health Organization report states that South Africa has one of the highest rates of teenage pregnancy globally. Research by the health agency shows that 1 in 5 girls get pregnant before they turn 20. At the same time, the report says HIV has increased among girls between the ages of 15 and 19. This stat is most worrying. 1 in 5 teenage girls falling pregnant by the time they're 20, well, at the end of 19, I suppose. What do we attribute it to?
Well, thank you and good evening to you and the viewers at home. It's a worrying issue because we would have been thinking of the statistic going down at this time. But now, sadly, the statistic is increasing. And if you just look at the statistic that you have indicated, we are not winning this war. And we know through our observation as Love Life that there are still many attributing factors to these issues. Firstly, it's socio-economic issues like poverty. We cannot avoid that. It's a fact. That,
so are you then suggesting that when we talk poverty, I'm sorry to interject, it might suggest that is it a values issue or is it an issue of let me go out, these young girls are receiving money in exchange for sexual favors?
There is transactional sex, but we don't want to start there. That's why I say socio-economic issues. It starts with how we are socializing, how we are living. These young girls are in a family where they don't have much to afford. And then she goes out and then she becomes vulnerable to these guys or men who knows what to do, who uses material things to lure them. And then they don't have much negotiating skills because they are looking forward at what they can get. And if you're looking forward to what you can get from these men, what are the chances of negotiating the use of condoms? The thinking or the discussion about postponing or prolonging the actual sexual intercourse, you don't have much chance. So then you get into the sexual intercourse or relationship or transaction hoping to get something to address social issues that you're going through in your family or in your social life. That is what is exposing our young people as well. Poverty. And we cannot avoid to talk about substance abuse. You know, there is a teenage pressure, peer pressure amongst young people where they go out, they pressurize each other, and then they engage in substance abuse. And we know that when you're intoxicated, the level of reasoning would change. The level of influence from others would increase. And then the chances of yourself being exposed, become vulnerable to sexual intercourse or sexual relationship increases as well. And how much do you have a strength to negotiate the use of condoms? And if in the absence of use of condoms, we're talking about sexual transmitted infections, we're talking about HIV and AIDS that we've just seen the stats. And then teenage pregnancy comes in the play. So that's the situation we are going through as a country.
Tilly, that's one half of the equation. And it's one half because we've talked about the girl child and we've talked about females. But let's talk about the men. Let's talk about the boys. You know, the perpetrators, the men who are making these young girls pregnant. What are the conversations that we should be having with them? Or what is their reasoning, right, in having unprotected sex or abusing or taking advantage of teenage girls?
You know, my example was very much intentional when I talk about men who have money. Because what we are starting to do is to have conversation with young men. We have a program called the Boy Child Program. Because we have realized that we are having these programs engaging girls, engaging women, but we are leaving behind this young boy who also is going through a lot. So the statistics will tell you that amongst these young boys, it's only, not even a quarter of them impregnating the teenagers. It's adults who are impregnating. And last time we were talking about educators who have been deregistered from the system because they are also part of the problem. So we have a program designed to talk to young boys to just engage them on who they are. What are the effects of them becoming young parents at that age of teenagehood as well. And we have very, very pictorial examples that we have on the ground, where we have young boys going through emotional distress because of becoming a father at that age. And they don't know who to talk to in most instances, and that's where we come in as Love Life.